A quality improvement initiative was done in NICU to increase the duration of kangaroo mother care for low birth weight neonates. Kangaroo mother care is a safe and simple method of providing care for low birth weight neonates. This includes continuous and prolonged skin-to-skin contact of neonate with the mother or any other caregiver in the family. World over, KMC has been recognized as a standard of care for preterm and low birth weight neonates. It has many associated benefits for the neonate like improved exclusive breastfeeding rates, better thermal control, decreased morbidity, decreased mortality, and early discharge from hospital. As per WHO recommendations, ideally KMC should be practiced uninterruptedly for 24 hours in a day. Any session of KMC lasting for less than 1 hour is stressful for the neonate. KMC is initiated for all preterm and low birth weight neonates as soon as they are hemodynamically stable. Mothers and other family members are counseled and prepared for KMC by healthcare team members including doctors and nurses, and their queries related to KMC are clarified. In the baseline data collection, we observed that the eligible neonates in our unit were receiving KMC for only 2 to 3 hours in 24 hours. So we framed our aim to increase the duration of KMC for eligible low birth weight neonates from the current baseline duration, which was only 3 hours in the entire day, to at least 6 hours by the end of 6 weeks using a comprehensive postnatal counseling package for mothers doing KMC in NICU. We formed a team which included a nurse educator, 4 in-service nurses, a resident doctor, faculty in charge of NICU, and a mother. They were counseled and prepared for KMC, and their queries related to KMC were clarified. Baseline assessment was done among the mothers of eligible admitted low birth weight neonates for a period of 1 week with respect to the prevailing KMC practices. Demographic profile related to mother and neonate was collected. This included the weight, gestational age at which birth of the neonate, age at which KMC was initiated for neonate, and the duration of KMC per day in hours. The information was collected in a structured questionnaire. Additionally, barriers to KMC practices were identified using an open-ended questionnaire for the healthcare professionals and mothers. We then did a root cause analysis to evaluate the reasons for decreased duration of kangaroo mother care. Some of the factors were lack of support from healthcare team, lack of initiative by other family members for KMC, which included lack of knowledge about KMC, no support to the mother, lack of confidence, lack of knowledge and confidence among the mother and family members in providing KMC due to absence of counseling sessions related to KMC. Lack of privacy for mothers or family members, stressful environment, inexperienced mother and family members. Additionally, mothers were spending around 5 hours in the entire day for expression of breast milk and nearly the same number of hours for feeding the neonate, meaning a total number of 10 hours. They were not able to do KMC at night time because they were tired and wanted some rest. Having understood the major barriers which limited the duration of KMC, we planned a PDSS cycle to address the main barriers. 4 nursing staff working in an ICU in different shifts were identified and involved in comprehensive postnatal counseling program planned for the mother and their family members. Implementation of this package included video shows on KMC for the mother and her 2-3 other family members in a small group. The benefit of KMC, the duration required, and the need of involvement of family member in KMC were discussed in detail by the bedside nurse. Mother and family members giving KMC were motivated to increase the duration of KMC. In cases where the mothers were the sole provider for KMC, their family members were motivated to participate in giving KMC to the neonate. Here, you can see that 1:1 counseling of the mother regarding benefits of KMC, the duration required, and the need of involvement of family member in KMC was done. In week 2nd of PDSS cycle, nurses were encouraged to ensure KMC for at least 2 hours in each shift, including the night shift. The staff nurses responsible for ensuring maximum KMC hours in their shift on weekly basis were felicitated and given a certificate of appreciation in periodic meetings. A promoting supportive environment in NICU was ensured for KMC. Mothers and the family members involved in KMC were also encouraged and acknowledged for doing KMC. Here you can see one of the nurse getting a Champion of the Month award certificate to reciprocate her dedication and contribution towards improving the duration of kangaroo mother care. Round the clock availability of nursing staff for neonates on KMC with some kind of respiratory support like oxygen therapy who decreased anxiety and fear of KMC provider due to occasional desaturations at the time of KMC. The results suggested that before implementing our QI project, the average duration of KMC was 3 hours and this increased after implementing the QI project. At the end of 5th week, nearly 70% of our mothers were doing KMC for more than 5 hours. At the end of 6 weeks, 60% of our mothers were doing KMC for more than 6 hours in a day, and KMC in continuous phase is sustained for more than 6 hours. Interestingly, some of the neonates received KMC for more than 16 hours in a day. The average duration of KMC has increased from 3 hours to 6 hours within a span of 6 weeks. The number of mothers doing KMC for 6 hours in a day was nearly 60%. The longest duration of KMC was nearly 16 hours in a day, and there was active involvement of mother as well as other family members for KMC. We undertook some active steps for sustaining KMC in post-implementation phase. Fathers and other close relatives were allowed in the NICU premises for doing KMC even in the night. The bedside nurse was assigned the responsibility for ensuring KMC at least 2 hours in her shift. This was also made an integral part of doctor's daily treatment order. The comprehensive postnatal counseling is being continued in the unit. We learned some very important lessons. Simple measures like active participation of family members and continuous positive reinforcement from treating health team resulted in improving the duration of KMC significantly. We also learned that to sustain this gain, we framed our unit policy in consultation with the entire team of nurses and doctors. This effort has the potential to ultimately translate into decreasing infection rate, improved exclusive breastfeeding rates, and early discharge. Thank you.